Hello, my name is Lauren Petrich, and I am a part of Group 6. And for our case study, we will be looking at borderline personality disorder. Um, Alongside me is Zimmy, Jaden, and Zach. So for the background information, Annabelle, which is a fictitious individual, is a 24-year-old white female who has been attending summer camp for the past couple of years as a camp counselor. There, she met Mike, a fellow counselor, and they instantly hit it off. After spending every second together, Annabelle starts to feel jealous and insecure about her relationship with Mike and starts to need proof of his commitment. Furthermore, she starts to develop an unhealthy attachment to Mike and requires that he constantly touches her and communicates with her. Otherwise, she fears that he is leaving her. For the further development of symptoms, what happens is that after moving back home for the wintertime, Annabelle and Mike break up because of a long summer full of drama. After 1 week back home, Annabelle spontaneously drives 10 hours in the middle of the night to visit Mike, where she tells him that she's going to kill herself if he doesn't take her back. After being brought home, Annabelle starts to engage in self-mutilating behavior, along with constantly degrading herself and her personality with comments such as, "I don't understand who I am. Nobody does. There's no one that gets me or understands me, and no one ever will." Along with this, Annabelle starts to engage in binge eating behaviors, along with throwing tantrums in her college courses. Although she has had these symptoms since early adulthood, they have increased with her relationship to Mike. Because of her symptoms, Annabelle does not have a stable social or work life. She does not have a stable social life because she is unable to form stable relationships due to her insecurities and mood cycling. Furthermore, she is unable to have a stable work environment because of her anxiety and anger issues, along with her self-mutilating behavior. Additionally, she cannot have a secure job because of her impulsive nature, such as driving to go meet her ex-boyfriend. Furthermore, as demonstrated with the effect on Annabelle's life, along with not being able to have a stable work and social environment, she is also, the effect it has on her life is that she is unable to make as logical of conclusions, and she is unable to be able to form other healthy relationships, along with being able to have a better relationship with herself. Because she is dependent on that other person, and because she has such conflicting views of herself. So for the presentation of symptoms, along with the diagnosis, is based off of that background information, she has self-injury, and that's through the self-mutilating behavior, anxiety, suicidal thoughts as portrayed with her telling Mike that she would kill herself if he didn't take her back, impulsivity as demonstrated by driving the 10 hours to go visit him in the middle of the night, manipulative, insecure, anger, intense interpersonal relationships, fear of abandonment. As demonstrated on the next couple of slides, as Zimmy will talk about, in correspondence with the DSM-5, we therefore diagnosed this fictitious individual with borderline personality disorder, which Zimmy will further explain in the next slides.
So the definition of DSM-5 for borderline personality disorder is a pervasive pattern of instability of interpersonal relationship, self-image and affect, and marked impulsivity beginning by early adulthood and present in a variety of contexts, such as indicated by 5 or more of the following. So the first one is a frantic effort to avoid real or imagined abandonment. So here we can see that Annabelle have a lot of symptoms that she is afraid that of abandonment. We're not trying to push the definition on her, but we are trying to see if she matches the description of DSM-5. And the second one is a pattern of unstable and intense interpersonal relationship characterized by alternating between extreme of idealization and devaluation. So she will hope that she will always idealize that the relationship that she has with Mike will be perfect, and then she will idolize it, But then when she break up, she will be like, I don't understand who I am. There's no one that gets me or understand me. The third one will be identity disturbance. So, like the unstable self-image or sense of self, like she repeatedly talk about herself like she doesn't understand her after the breakup. Next one is impulsivity in at least two areas that potentially self-damage. She binge eating. She is driving just to see Mike in the middle of the night for no reason. And after that, we have recurrent suicidal behavior, gesture, or threats, or self-mutilating behavior. So you can see now number 5 here in the DSM-5 can be talk about number 2, number 4, number 1 that can match. But for any action or behavior that have suicidal or self-mutilating behavior, you can only count it as number 5. You cannot like do it with number 1 or number 4. Annabelle have a self-mutilating behavior, and she sent out multiple suicidal threats to her ex-boyfriend. For number 6, we have affective instability due to a mark of reactivity of mood. So, for example, she's anxiety, intense episodic dysphoria. So we can see that this can be worked with. We can see that as like in she doesn't have the unstable of mood to remain in a relationship or remain in a social life or work life. Number 7 is the chronic feelings of emptiness. So Annabelle always have the feeling of like, I don't understand who I am, no one that gets me or understand me since early adulthood. But this only increased and appear more often with the disappearance of Mike. Number 8 is inappropriate, intense anger or difficulty controlling anger. So you can see that she have a lot of tantrum with her colleague and then her friends, so she cannot have a stable life or a social life anymore. And last is transition stress related paranoid ideation or severe dissociative symptoms. For now, she doesn't have any, but for borderline personality disorder, you just only need indicate by 5 or more, and she already indicates more than 5 in this case. And so borderline personality disorder may co-occur with other different diagnoses. So how do we know that Annabelle actually did have borderline personality disorder? So the most diagnoses, for example, depressive and bipolar disorder, other personality disorder, personality change due to another medical condition, substance use disorder, or identity problems. So borderline personality disorder can co-occur with depressive or bipolar disorder, but when the criteria for both are met, they can be both diagnosed. But because the borderline personality disorder can mimic an episode of depressive or bipolar disorder, therefore any diagnosis should only based on documented or pattern or behavior that had early onset already. Next, we will go to other personality disorder may be confused with borderline personality disorder because they have certain features in common, but they have also a lot of different in their characteristics. For example, histrionic personality disorder can be characterized by attention-seeking, manipulative behavior, rapidly shifting emotion. The borderline personality disorder is distinguished by self-destructive, angry disruption in close relationship, in the chronic of feeling emptiness. Paranoid ideal illusion may be present in both borderline and other personality disorder, but these symptoms are more transition in personal reaction and responsive to external. Although paranoid personality disorder or narcissistic personality disorder can be characterized by angry reaction to minor stimuli, the relative stability of self-image, but this also distinguishes the disorder from borderline personality disorder. And then for antisocial personality disorder, they can be both characterized by manipulative behavior. Individuals with antisocial personality disorder are manipulative to gain profit, while borderline personality disorder present symptoms to gain more like a direct of like concern of caretaker. And then for dependent personality disorder and borderline personality disorder are both similar in the fear of abandonment. However, those individuals with borderline personality disorder react to abandonment with feeling of emptiness, rage, demand, where the dependent disorder will try to submissive and seek a replacement relationship to provide caregiving and support for them. For borderline personality disorder with personality change due to another medical condition, we have to know that the symptoms of borderline personality disorder does not occur because of the use of a substance. So all of the symptoms must come from itself, not coming from any drugs or alcohol abuse or anything like that. And for last one, identity problems. Borderline personality disorder should be distinguished with identity problem because the identity concern, the reverse for identity concern relates to a developmental phase, for example, like adolescent, and does not qualify as a mental disorder. And after this, we'll come to Jaden for etiology and
now moving on to the etiology of borderline personality disorder. So initially, just overall, the etiology of this disorder is, first of all, the inability to modulate emotional dysregulation and the use of maladaptive regulation strategies. These can be, for example, ruminations, or just constantly thinking about things that have happened in the past and dwelling on those and not attempting to take steps to right them or to make things better, but just to think about what has happened, to be critical, to beat oneself up, you could say. Or another strategy could be avoidance, just avoiding the problems altogether and not taking, there's a lack of taking steps to actually solve the problem, but there's an emphasis placed upon either sitting in the thoughts, thinking about them, or just simply avoiding the problem. There are other examples too, but it's the use of maladaptive emotional strategies for the regulation of emotions. Then there's an inability to stop the dysregulation of emotions, which then causes or perpetuates the mood swings and things. Next, there are unstable social relationships. These can be friends, family, maybe a significant other, any kind of toxic relationship in which the person does not feel stable and perhaps wants to get out, or just feels like they're not loved or valued or not stable in their relationship. And then childhood abuse and neglect, and psychological disorders in family members. This can be any kind of disorder. It doesn't necessarily mean that the person will have that disorder, but in this case, simply having a family member who possesses any kind of psychological disorder can put a person at risk for borderline personality disorder. So it can really be anything, but just having mental illness in the family can be a risk for this. And then improper functioning of serotonin, which causes the dysregulation of emotions. Genetic predisposition, a person can inherit borderline personality disorder. Losing a parent at a young age, it can cause a child, which then becomes an adult, to have a loss of self-identity which is common to borderline personality disorder, because they might take stock in their relationship with their parent who was passed, and then not know who they are because that parent is gone. And then parents with substance abuse, and then unstable family relationships or conflicts within the family. Any kind of toxic social relationship can be a detriment and can either cause or perpetuate this disorder in some way. And then moving on to Annabelle, the person in this case study, then what the etiology for her disorder is frequent physical abuse by her father when she was a child. So this ties in with the abuse and neglect that a child might receive, and then they develop this disorder and they become an adult. So Annabelle was abused. Unstable relationship with her mother, who then blames her for the abuse she received. So she has an unstable relationship with her mother. Therefore, she's lost the ability to form stable relationships with other people, in this case, her boyfriend. And she doesn't know how to maintain stable relationships. There's a history of schizophrenia on her mother's side of the family. So in this case, then there is mental illness in her family, so that puts her at a greater risk for developing borderline personality disorder. And the father abused alcohol. So there's substance abuse in the family and in the household then when Annabelle was a child. So therefore, she is at an even greater risk for developing borderline personality disorder.
All right, moving into prognosis and treatment for Annabelle. Many BPD patients suffering prior abuse have good treatment outcomes. So there is hope for her symptoms to improve. The best method for treatment is to treat the underlying abuse and trauma that she suffered. This might include, depending on Annabelle's situation and her relationship with the therapist, using concrete operational reasoning treatments, which might be rooted in childhood therapy treatments. So even though Annabelle is an adult of 24 years old, we might end up using, or a therapist might end up using techniques commonly used in children because we're trying to treat underlying abuse in childhood. We also may be retraining childhood skills, so learning to get through emotional problems. We might use treatments that would commonly work in kids. Importantly, treatment will take time. We're looking at a time scale of years for improvement, not months. And importantly, psychotherapy will be helpful, but it could be challenging for her therapists, requiring balance on the part of the therapist between re-nurturing Annabelle and setting limits and boundaries so that Annabelle does not become attached in an unhealthy way to her therapists. Additionally, group therapy may also be helpful, especially looking at groups that use dialectical behavior therapy from Marshall Linehan. This teaches patients to talk to and nurture one another in group settings and helps decenter the therapist's role and develop self-advocacy skills in individuals and gives them a group of people that are going through similar things so that they can sympathize and empathize with each other, which is really important. Ultimately, Annabelle will likely benefit from a team approach using a psychiatrist, a psychologist, and a group therapy session, depending on the severity of her symptoms and goals for treatment outcomes. Common pharmacologic interventions include antidepressants, anxiolytics, and antipsychotics. Thank you so much.